This episode of Primitive Culture is brought to you by Audible.com, offering more than 180,000 titles for smartphone, tablet and desktop. To get a free audiobook of your choice and to help Trek FM at the same time, visit audibletrial.com/trekfm. And also by Enterprise in Space, an international programme of the non-profit National Space Society. Find out how you can help science and education and become a virtual crew member aboard the NSS Enterprise Orbiter by visiting enterpriseinspace.org. And if you want to join the conversation and share your thoughts on this episode, join the Babel Conference, our listeners group on Facebook. Just type BABEL into the Facebook search field. We look forward to seeing you there.
This is Tim Russ, Lieutenant Commander Tuvok on Star Trek Voyager, and you're listening to Trek FM.
Open your mind to the past. Oh, this may mean something.
I've been coerced into watching tonight's movie.
You do have books in the 24th century.
It's a primitive culture. I'm just trying to blend in.
Some people think the future means the end of history. We haven't run out of history quite yet.
Hello and welcome to Primitive Culture, a Trek FM podcast all about our history, our culture and how Star Trek relates to it. I'm Duncan Barrett and today I'm joined by Clara Cook. Hi Clara, how are you?
Hi Duncan, I am nice and healthy and still here.
Safe, cocooned, locked down, sheltered at home. Is that what they call it in America? Sheltered in place.
Sheltered, is that what
right?
they say?
Every country seems to have a different terminology for what we're doing, yeah. Actually,
place.
I don't even know what ours is, to be honest, because we're not technically under lockdown. Well, maybe you're under lockdown. I'm under social distancing and kind of, I think they've sort of avoided even providing an exact word for it, but broadly speaking, we're under lockdown, yeah. Yeah,
it's not quarantine, is it really? But it's kind of feels like it.
It certainly does. And I think you've been observing these rules slightly longer as well, haven't you? Is that right? Then you were doing it already before the whole country got kind of put on this new regime.
Yeah, so it's day 38 for me. So I have been out of the house briefly for short walks, socially distanced walks. I've been to the supermarket twice with gloves and a mask, but I don't really go to the supermarket at all. I have either food deliveries or my husband goes grocery shopping with gloves and a mask. And so it's day 38. So I started socially isolating. I worked from home on the 13th of March, Friday the 13th, that fateful day. And it was part of a trial at work to see if we could work from home in the event that the university was going to close. And then over the course of that weekend, the news and also my concern and what the government was doing and what was going on, and also having consulted my own doctor, I decided that I wasn't going to go back to work. And then about a week later, they closed the university. So all my work colleagues continued to go to work for a week. And I felt quite tortured about that, I have to say. Working from home, I felt like I was maybe being a bit chicken, being a bit cowardly. And looking back on it now, I'm like, what was I thinking? This is totally okay. But yeah, so it's been a long time. It feels oddly like it's gone very fast and oddly like it's very, very slow as well.
You see, I'm kind of used to the idea of working from home. It's the not being able to go out other than that, one exercise session a day or whatever, walk the dogs or whatever it is, that it feels slightly alien to me. I miss my going swimming and kind of the freedom really more than anything. The actual working from home, if I can get any work done, because we've got a 4-year-old in my house, which means we're notionally homeschooling, which I think is a bit of a misnomer in our case. We're basically trying to keep a small person entertained and happy, and throwing in the odd bit of sort of educational activity. But that seems to take up quite a lot of the physical and psychic space, I think. So actually, someone described it, I think they said rather than calling it working from home, they should call it being at home and trying to get some work done, which I think is more accurate, really. Have you been out of your house on Thursday nights to applaud the NHS workers, or have you been applauding from your window, or have you been listening to, I imagine because you're in London, the noise is probably more cacophonous there than it is in my slightly sleepy town. But even here, there's if you're not primed for it. If you've forgotten that it's happening, you'll be kind of jolted into it by someone banging a dustbin lid, several doors down and kind of getting the whole town going.
Yeah, I mean, I can go out into the garden, but really what I normally do is lean out our windows to the sort of front of the house, into the street. And so I can see everyone else leaning out of their windows, and everybody's come out into the street. And it's very loud here. It's it's a really joyous thing. I think in London, or maybe it depends obviously where you live, but on our street, a lot of people are also whooping. There's a lot of cheering and whooping as well as clapping, and I think a lot of it is actually cathartic for people to just have a scream out their window because they've been locked in for so long. But yeah, it does feel really good. And the other day, the bus driver went by and he sort of stopped his bus at the bus stop, and people applauded him specifically. And he's not an NHS worker, but he's an essential, I mean, the other bus drivers on this route that we have here are essential workers, they're frontline workers. So, and
a lot of them have died.
Yeah, a lot of them have died,
as well as all the doctors and nurses who've died, there have been quite a large number of transport workers who've died that we've heard about. So they're absolutely, on the front lines in a sense in those jobs.
Yeah, so it's kind of nice to be able to actually applaud somebody who's there right in front of you, and they can actually see the applause, and that was really lovely. And all around here, there's signs in everyone's windows, sort of thanking the NHS, really encouraging signs of rainbows, a lot of them drawn by kids, which is really cute. Sort of kind of saying to people, like, keep your head up, this will end, So I think the mood here is, like, really encouraging. There's a lot of community groups online that are helping out their neighbours, and people are within social distancing rules. People are like going shopping for people who are really elderly, or who are living in households where everybody's sick. So there's some really positive things to come out of this, as well as all the really depressing things that we see on the news as well. So
I think it is interesting. It's something that has certainly focused attention on our health service in a way that maybe we've never seen to quite that extent before. I mean, the health service gets kind of bandied around, and we've had a lot of election campaigns recently where there have been threats to the health service. There's been this kind of, this idea. And I mean, it may be this coronavirus may be in some ways the thing that saves the NHS, because it has kind of absolutely brought public attention onto it in a very positive way. People are coming out in the streets, they are celebrating, they're raising that 99-year-old man who's raised £20 million. I mean, whatever you think about the kind of ethics of the NHS being treated as a charity when arguably it should be, government funded, as it is supposed to be a part of the kind of national infrastructure, it does show how much people are how much people believe in it. And I think, not that long ago, the last election campaign, we were having all this stuff about, is Trump trying to buy the NHS? Are we privatising? We've already privatised certain aspects of the NHS. Is the NHS in danger of being lost, basically? Now it sort of feels like that would be very difficult in some ways. But it kind of also, it's interesting to think about it in a sort of global context, because obviously, we have our own sort of history about our health system and our own ideas about our health system. I know a lot of other countries, they have similar things. I mean, I heard an interview with someone who was in Canada talking about and I can't think of his name, but I'm sure our Canadian listeners will know who I'm talking about, the guy who basically set up the National Health Service in Canada, who is a revered, figure there. The reason all this is relevant, the reason we're waffling at such great length about what's going on kind of at the present moment, and I should say, I mean, we don't normally talk about the kind of exact period that we're recording in, because there's often a bit of delay while we get these things edited and so on. But we're recording on the 20th of April, for what it's worth. So if anything we say today turns out to be wildly out of date or seems inappropriate, that's why. That's when this discussion is coming from. Is we're going to be looking today at the Voyager episode Critical Care, which is a late Voyager episode, and it's quite an interesting one because it's one that very much is considering the kind of issues around healthcare, around some of the problems potentially with healthcare systems. I mean, I'd be interested to know what you think. I always viewed this episode as very explicitly a critique on the American healthcare system, the kind of privatized model, which is very different to socialized medicine, as they call it in America. I was rather shocked when I first heard that term, but, with huge scare quotes around it. But, to us and to most Europeans, this seems completely normal. But But I know that some people viewed that episode the opposite way, because I've had conversations with Americans who said that they thought it was a criticism of European, of socialized healthcare, basically, of a kind of a different model. So it's interesting that it can be interpreted in different ways. But however you look at it, that episode is very much trying to say something, or at least trying to raise certain questions around the ethics of healthcare and the ethics of a healthcare system and how it treats the patients who rely on it.
Yeah, so I understand what you're saying. I think the episode is viewed differently by different cultures. Specifically, I would say American versus British viewpoints, or American versus European viewpoints. I think that the issue that I have with seeing it as a criticism of socialized medicine or a national healthcare system, which is free at the point of entry, like the NHS, is that the episode is... In this episode, in critical care, the healthcare system is very much centered on people being given a qualifying number, and that number is devised by a formula which considers lots of different things, but primarily their usefulness to the society that they live in a sense, a meritocracy. But the issue with this is that isn't what socialized medicine is. I mean, I don't get healthcare because I am useful to British society, or I'm not useful to British society. I get healthcare according to my need, as each according to their needs. And that's more socialized medicine, each according to their own needs. If I need, God forbid, to be put on a ventilator, then the NHS will do their very best to put me on a ventilator. If I need an X-ray because I broke a bone in my foot, the NHS will give me an X-ray. If I don't need one, then they probably won't. Whereas a few times I've been in the American healthcare system, not many times, but a few times I've actually been given tests I don't need because my father had such great medical insurance through his job when we were there. And, I remember once being in the emergency room in the US when I was a little girl, and I had a terrible, terrible case of tonsillitis and a very, very high fever. And they examined me for all of this and did all these tests. And then I mentioned to the doctors, I said, I have a tummy ache. And my mum said she almost gagged me because she said, because then they were like, well, maybe we should x-ray her stomach. And my mom was like, no, don't do that. Like, there's nothing wrong. She's like, I was like a 9-year-old or something. She's like, got a stomach ache. So I think that's one of the major differences. There is a system here, and I myself have also been a victim of it in the UK, specifically with some life-changing medical treatment. I don't know if I should say on the podcast. I'm not ashamed of it, but I myself and my husband are infertile, and we have tried multiple times to have children through IVF. And it's been quite a frustrating experience because we only qualified for one cycle of IVF on the NHS because of our postcode. And the postcode lottery is basically, depending which borough you live in, different types of healthcare are apportioned to you. Nothing like, well, hopefully nothing life-threatening and life-saving. Like, I think if I was actually dying, they're not going to send out or not send out an ambulance to me depending on where I live. But for something like IVF, I lived in a borough in South London at the time, and I qualified for it, and I only got one cycle. And one cycle isn't really enough when it comes to IVF. Anyone who's been through it knows you need to have at least 3 cycles for any sort of kind of success. And so the second cycle we had to pay for privately. In the US, they would say, oh, well, that's being determined for you by the government. It should be your right to have 3. But the idea that a meritocracy only works if everyone's born on a level playing field. And what's shown in this episode is that even when this young man, what's his name? I can't remember his name.
The young guy who wants to be a doctor, basically.
The young guy who wants to be a doctor, yeah. And he's shown having talent, but even though he's shown having talent, he is kind of determined to go work in a refinery. He's just not of high status enough to even be able to train as a doctor. So not only is he not of like high status enough to be able to get medical care, life-saving medical care, but he's also not high status enough to be able to lift himself to a higher status. So that's the essential problem with giving people healthcare in a meritocracy, or based on merit. And so this is a long explanation, but this is why I do not think this episode is about socialized healthcare systems. I think it is about a healthcare system. It's about inequality. I actually think it's a critique on the American healthcare system.
Absolutely. And as I say, I completely agree with you. And maybe I would, because, we're coming at it from pretty much the same perspective. And I wouldn't necessarily assume that all Americans agree with those who think that it is a critique of kind of European socialized or nationalized healthcare models. I think many of them see it as we do, as a critique of the American system. It is true, it's confusing because they take out the money element, because it's not really, the inequality is not based on money, it's based on this quotient, which is to do with perceived value to society and so on. I think that does kind of skew things slightly. But to me, the key takeaway really from this episode, certainly if you look at it from the Doctor's perspective, the Doctor's kind of being, I was going to say beamed in, he's not literally beamed, he's kidnapped and brought into this situation and activated in this hospital. And what he can't get his head around is the fact that people are being treated unequally within the same hospital, and that his approach is, as you say, treat people according to their need. He sees someone who's dying, he rushes over and tries to help them. That's his Hippocratic oath as far as he's concerned. Whereas he's being told by the kind of institution there, oh no, you're needed on level blue. Level blue is where your dad's health insurance would no doubt have sent you. You're needed in the kind of what looks like, level blue looks like a private hospital here. And I know a bit about this because my mum has, again, I don't know if it was through her, but anyway, for whatever reason, she has private health insurance and she did have to have several operations. And the hospitals that she would have these operations in were very different to any hospital that I've ever been to, if you know what I mean, on my own behalf. Not to say that the NHS is kind of run into the ground or whatever, but it is, I think it does an amazing job with the resources they have, but it is underfunded. They are always struggling to kind of keep things going. Some NHS hospitals are more kind of shiny and modern looking than others, but it often there is a sense of, people doing really good, important, high quality work, but with limited resources, limited kind of not the most salubrious environment necessarily or whatever. Whereas this kind of hospital that my mum was having her operations in was like a hotel. It was all very beautiful, pristine, kind of relaxing, calm, hardly anyone there. Do you know what I mean? Totally different experience, really. And that's what you get, obviously, if you can afford and choose to pay for it. But it certainly feels like in the Voyager episode, that's kind of what we're seeing in that hospital, is the people, the people who are considered valuable, and they are the people who do the jobs that in a capitalist society and in our reality are the well-paid jobs, and therefore they are the ones who probably could afford the better treatment or whatever, are being treated very differently from those lower down. And even to the extent of this idea of some of them, the very drug that the people on the bottom level need to survive is being given as a kind of preventative measure to those on the higher levels to kind of ward off, almost as like a sort of supplement or something. They don't essentially need it. It's not a matter of life and death that they need it, but it's being kind of siphoned off to them because it's sort of vaguely beneficial to them, and therefore the others are not getting it. So to me, absolutely, it's the inequality that is the key element of this system, and that is absolutely, I suppose, what from an outsider maybe the American system looks like, that particularly at the bottom you have people who are really struggling to get treatment. My aunt lived in America for most of her career basically, and she, towards the end of her professional career, got quite sick, and she almost died because she didn't have health insurance or whatever. She left her job or whatever by this point, and I think was financially not in a particularly good situation. She didn't have any health insurance. She got sick and she was sort of mulling it over, do I call, how sick am I? Do I call the ambulance or not? What am I going to do? And in the end, I think her neighbour or someone called an ambulance for her basically because they were so worried about her. And they said to her, you would have died if you'd left this any longer. But she was waiting because she was going to be eligible. I don't know what age it is that you get whatever kind of
Medicare, right? Exactly.
She was thinking, I'll wait until I can do that. And in fact, they were saying, look, if you'd waited, you wouldn't have made it to that age. You'd have been dead by then. But she was then stuck with this enormous bill, and I don't know if I should even be saying this. But basically, she had to come home again because she couldn't pay the bill in the States, and so she left the country. And as I understand it, can't go back there. And whatever people might have different opinions about the rights and wrongs of all of that. But certainly it gave me an insight into this idea that, you know, the people who cannot afford the treatment that they need to save their lives, that is a terrible situation to be in. I mean, the NHS, you're right, there are definitely aspects of it that are less than satisfactory. The postcode lottery thing would be one of them. Certain kinds of care in particular, I mean, there are often quite long waiting lists for operations. Something like mental health, again, wildly variable what kind of help you get depending on where in the country you live, partly just because of the number of people accessing these things. So they can have a kind of national system where they have sort of a scheme that is supposed to be followed at local level, but in some places you might, you know, if you say you need to see a counsellor or whatever, in some places you might see one within a few weeks. In other places you'll be waiting 9 months before anyone speaks to you, which, you know, if you're going through a mental health crisis it's not necessarily something you can wait for. So certainly there are elements where the NHS doesn't really work as well as it should do. But there is a basic principle, you know, if you break your leg, if you get run over in the street, if you have a heart attack and you get rushed into a hospital, whoever you are, you're going to get the same treatment. If they can save your life, they will do, and you're not going to be, you know, in financial peril as a result of that treatment.
Yeah, and I think we have to remember that the NHS is not like a siloed institution that isn't affected by everything else as well. So sometimes some of these problems that happen with our healthcare system, which is what I would assume one of the things that would have led to the healthcare system in the episode Critical Care, is the allocator, not the allocator, but the head administrator who is working with the allocator, who's obviously the computer that's allocating resources, sort of explains that one of the reasons why they've got this system is because they didn't have enough resources to go around. And one of the reasons why the NHS, like, you know, why the postcode lottery exists is because they don't have enough money to pay for everyone to have 3 cycles of NHS, IVF on the NHS. And there are, you know, resources issues. And one of the reasons why there are resources issues is because they're short-staffed, and they're short-staffed because it's hard for key workers to get housing. You know, I mean, a nurse at the top of her field makes, you know, a salary, a fairly okay salary, but it's not really enough money to be able to necessarily afford to buy a house, or do you know what I mean? It's not, they're not wealthy. The nurses and doctors aren't wealthy. And housing in the UK is, in certain places, very expensive. I remember talking ages ago to a person who I met at a dinner party who was a nurse. She was a nurse in an intensive care ward, actually. And I've been thinking about her fairly a lot, actually, nowadays, because of the pandemic. I assume she's still working in the NHS. And she was living and working in Oxford. And she was describing about how the housing in Oxford was so expensive that she was really struggling to find a place to live. But they need nurses in Oxford to work in the hospital. But if a nurse can't afford to live in Oxford, she might choose to go somewhere, or he or she might choose to go somewhere else, and then you have a lack of nurses in the NHS. So what I'm saying is that the NHS itself, the resources of the NHS itself, are affected by everything else in our society as well. They're affected by housing. It's affected by, you know, the amount of money that we have available to pay for medication. You know, the amount of money that we have available in our society to pay for medical equipment, that kind of thing. And so I think a lot of people, when they see the NHS, especially from outside the UK, they think, oh, well, it's, you know, the decision of whether or not you get the treatment is made by a bunch of doctors that you never meet, or, you know, you go into hospital and you don't get the treatment that's top notch and top quality. But I guess what you're doing in the UK is you're sacrificing a certain element of personal choice so that everybody gets healthcare. And that's the intrinsic difference. I think it's, do you want to choose your doctor? Do you want to choose exactly the level and the type of healthcare you get? And then not everyone to have healthcare? Or do you want to sacrifice some of your personal choice in this way so that everyone can get healthcare? Like, I can choose which GP surgery, general practitioner, for the people who don't know where GP is, I can choose which doctor's surgery I register with, but I can't necessarily choose the exact doctor I go see at that GP surgery. But that's okay, because I know that everyone who's in this area who can register with the GP will have access to free healthcare there. Whereas I assume, like, what happens in the US, when I talk to my aunt who's based in the US, she's like, do you have a family doctor that you have gone out and found and you chose your family doctor? And I'm like, well, I didn't choose my family doctor, no. But that's okay because everybody in my area gets a doctor. So, free of charge. And I mean, I pay for prescriptions, but some people who are not at a certain income level as me don't pay for their prescriptions. And I'm okay with that. I'm okay with me paying like £8 or £9. And I'm okay with the person who comes in the line in the pharmacy after me, who's like a little elderly old person or someone on a low income, not paying. And I know that my money has gone to pay for them. But it's kind of the idea is it's about sacrificing some of yourself, your wealth, your personal choice, your freedom, so that everybody can have that freedom, if that makes sense. And I think that's kind of a fundamental difference from what the American healthcare system is, which is that I don't want to sacrifice my personal choice. I don't want to sacrifice my personal freedom so that everybody can have the same as me. But that's a really kind of goes against what this episode is saying, you know, like it kind of goes against the whole idea of Star Trek. On a starship, everybody has to kind of work together. And although there's individualistic expression, you know, Neelix is very different than Janeway, shall we say. There's a hierarchical structure, but like they do have to make personal sacrifices in order for the whole of the ship to operate, if that makes sense.
Yeah, and certainly if you're, you know, everyone on a Federation starship is going to get the same medical treatment, you know, not only throughout the kind of command hierarchy and so on. Although it's an interesting question. I don't know whether, because there is that episode of Voyager, isn't there, where the doctor has to choose between two patients, which one does he save? And he has this kind of effectively a mental breakdown over the fact that he chose one over the other because there was no medical basis for making that decision. Because you do have this kind of system of triage which has come into the news recently here because, and almost in a sort of battlefield context, because you get triage when you go into a hospital. This is one reason why most people's experience of the health service in Britain, well, certainly for me, you know, growing up in London and for you too, I imagine, when you go to casualty, when you go to the emergency room, basically because you've, you know, broken your leg or cut yourself or done something or whatever, you will be triaged. That's the first thing that will happen is a nurse will see you and you will get kind of prioritized according to how urgent it is. And basically, you know, if you're having a heart attack or something, obviously you'll go straight and you'll see a doctor straight away. If you're in a situation where you're not imminently in danger, you will probably end up sitting there for 3-4 hours potentially. You know, you might be there a long time. One thing I noticed since having a child actually is if it's a child, even if it's one of those quite minor things, they suddenly get seen much more quickly, which I think is interesting. So there are, even within that kind of equal system, there are elements where they're making decisions partly about the danger to the patient, but they are, I suppose, prioritizing certain groups of people. But, you know, I would say arguably with good reason. In those situations, an adult can probably cope with sitting there and dealing with a bit of pain for a few hours in order to be seen, but you know, a 3-year-old can't really manage that. And you know,
but also, like, I have a friend who's a pediatric nurse, and she says fairly often that, like, children, like, because they have such fast metabolisms, they can decline very quickly, and something that is relatively minor can become quite serious quite quickly. Like, for instance, children's temperatures can rise very fast and fall very fast, a lot quicker than an adult could. So it could be that they see a child and they're seeing the potential for further danger.
There may be a medical basis for that anyway. Well, anyway, I was just going to say it's interesting because at the moment there've been talk about you know, if we do end up in this crisis where there aren't enough ventilators for the number of people going into the hospitals, and, you know, we've seen here they've been building these massive hospitals, just as they did in China. Funnily enough, the NEC in Birmingham, where we've been going for the Star Trek conventions for the last few years, is now a hospital. It's one of these Nightingale hospitals. There, you know, huge preparation underway to deal with the potentially vast number of people that are going to need to be treated. But ultimately, there is the danger that there isn't enough treatment for the number of people coming in. And then there are questions about who do you treat? And in Italy, I know they passed a law, quite controversially, saying, and I don't know what the kind of repercussions of this have been, but obviously they're kind of a bit ahead of us on all this, but there was this whole discussion about the fact they passed a law basically saying anyone over 70 was not going to get a ventilator if there was a shortage, essentially. So there is a kind of form of triage there, of prioritising some people over others. And I know in care homes here, there's been discussion about trying to persuade residents and their families to sort of almost decline treatment if it gets to that situation, and prioritise younger people over older people and so on. So there are all those kind of questions about triage. But ultimately, I'd say with a system like we have, although you might find elements of unequal treatment according to various factors, the goal is to save as many lives as possible, and in that sense everyone is all in it together. Do you know what I mean? There might be specific reasons why one person gets seen before another, but they're not based on that person's ability to pay or that person's sort of social value or any of these kinds of things. They're based, I suppose, on medical criteria, really, which is very different from what we see in the Star Trek episode, where the drugs that could be used to save a life on one level are almost being thrown away on a different level on people who don't really need them.
Yeah, and I think one of the major issues in the medical system in critical care is that, like, the doctor says this as well, it's not just where you allocate the resources, is that almost they're, like, knowingly allowing people to die. Because some of these people are uneducated, you know, they don't have a high enough, like, rating, because they aren't skilled enough, or they're not doing the right kind of job. And the guy actually says, whatever his name is, I can't remember his name, the administrator, Administrator Chelik, you know, okay, can I just stop this for a second and say, that I'm an administrator, so every time an evil administrator comes on television, or actually Star Trek is kind of full of evil administrators, actually, I feel a little pang in my heart. I think, oh, not all administrators are bad. Sometimes you need administrators. Anyway, so yeah, Administrator Chelik actually says, you know, these people are a drain on resources, you know, and you're thinking, well, what resources? The resources that you're actually, like, allocating to people who don't even need them yet. You know, you're giving people this drug that may prolong their life some way, but, you know, there's nothing wrong with them. They don't need this drug yet. And you're choosing to give it to them and not to somebody who needs it to save their lives. So it's more than just, like, prioritizing people. It's actually knowingly not giving people medical care because you deem them not to be worthy enough for the resource in the first place. And in a way that is, I would say, kind of doing harm. And surely the doctor's, like, a doctor's mission is to do no harm. I mean, that's the Hippocratic Oath, right? Is to treat people and try and make them better, but to not knowingly do any harm. And so you have to question whether or not the doctor working in the blue sector is actually abiding by the Hippocratic Oath. I guess the Hippocratic Oath doesn't apply across the entire galaxy, but it definitely applies to the Doctor and the Voyager, and that's why he's so horrified. Well, there's one question
I meant to ask you before we started, and I forgot.
There's a question that I was going to ask. I could ask Judge could just say off the back of what I just said.
Fine. Okay.
But I guess the things that I was going to, obviously we talked about NHS, American healthcare system, limited resources, herd immunity. I was going to also, maybe at some point we could discuss about how this is quite a TOS episode. I thought it was very like the original series. I was quite surprised when I was watching it, how original series it was. And also the value, the idea of the value, like, can people's intrinsic value be determined? And if they can be determined, like, who determines that, you know? Because at one point he says, the doctor says, like, useful to whom or whatever. But this question I was going to ask is, so I'll just move on from that. You can cut all this out. So this leads to the question, which came up in my mind, like, during the episode, is, in a society with limited resources, you know, they implied that this planet was dying before these administrators came along and the allocator was installed, you know, and now this society is now flourishing because they aren't drained of resources. Do we really want to live in a society where some people have to die so other people can thrive? Do we really want to live in a world like that?
Well, I think absolutely one of the things that's most shocking for the doctor in that episode is this idea of patients being denied treatment that they need that could save their lives, to the extent that ultimately that young guy who you mentioned who wants, has dreams of his own to become a doctor himself and so on, is not given the treatment that will save his life and dies as a result, as it turns out, because the doctor has kind of exceeded his quota of medicine, basically. But ultimately, these people are making decisions to withhold treatment. And that absolutely, for me, is the thing that made it feel very much like a critique of the American system. I don't know if you've seen the Michael Moore documentary Sicko, but I saw that when it came out in the cinema and was very shocked by it, because what he does in that film is partly, there's a lot of interviews with people. There's the guy, for example, who cuts 2 of his fingers off by accident and is told, well, this finger will cost you $10,000 to put back on. This finger will cost $60,000. So, you're going to do one or the other or both or whatever. And he ends up having to choose which, how much is he going to pay? How much can he afford? And which finger is he going to save? Something like that, certainly from our perspective, is horrifying and shocking. But the thing that struck me, the thing that stayed with me really the most, from seeing that film many years ago, were these doctors who are people who have, devoted their lives. They spent many years training to do something that we think of as this kind of noble profession where they're going to save lives and help people. And they end up working for these insurance companies where their job essentially is to find ways of disqualifying people so that they don't get the treatment that they need. There are people who are being interviewed, there's a woman, for example, whose husband was denied treatment and died. And there's footage of one of the doctors testifying in front of some kind of like Senate committee or something, some kind of official sort of investigation, and basically saying, I'm ashamed of myself. I've participated in this system where I, as a doctor, have put my name to things knowing that ultimately people are going to die as a result. I have not been acting as a doctor. A doctor is supposed to be healing people, and I've basically been condemning people to death. And that, I think, is the thing that is most shocking for me about that kind of reality and that kind of system. And again, I think is the thing that for me in critical care is what comes out. It's this idea that they are willfully denying people treatment when they have the resources, they have the capacity, they have the ability to save those lives, and they're choosing not to.
But they don't see it that way. They don't see it as like, we see it that way. But I think in the actual episode, the doctors themselves don't see it that way. Or certainly Administrator Chellick doesn't see it that way. He's not a doctor, but he doesn't see it that way. He sees it as like that he's doing this for the greater good. He's doing this to keep a society afloat. Like, the doctor says, the doctor from Voyager says, I'm trying to save people, or I'm trying to save my patient. And, Chellick comes back with, I'm trying to save a society. Like, I'm not saying that Chellick is right, but I'm saying that in his mind, he is doing what he thinks is morally right. And later on, he's doing something immoral but he thinks an immoral action that will have a moral outcome. Do you know what I mean? The end justifies the means. And interestingly, later in the episode, the doctor actually does something which is considered immoral. He deliberately makes Chellick sick in order to bring home the point that if Chellick doesn't have the right rating, he's not going to get the medical care he needs. So he sort of threatens Chellick's life in order to make sure that, he gets the care to the other patients that he wants to treat. And so he does something immoral for a greater good. He's willing to sacrifice Chellick to save other lives. And that's almost what Chellick thinks he's doing. He's willing to sacrifice lives to save this society.
Ultimately, though, isn't it a bluff? I mean, on the doctor's part, I know there's this agonising, and at the end of the episode, he has this moment with Seven where he's saying, how could I have done such a thing? I'm a doctor. Why did I infect this man? And yes, on the one level, he's doing it for the greater good. He thinks he's going to be able to save more patients. But he's also not actually killing the guy. It's a bit like, in that DS9 episode where Sisko, and Sisko does go the whole hog when he's chasing after Eddington and he makes that mucky planet uninhabitable, that he launches the torpedoes at them and no one can quite believe it because we assume that he's bluffing. Well, I sort of feel in this episode with the Doctor, he knows the guy is not going to die. The system is going to be changed. It's going to be he's going to find a way of reorganizing it, reallocating it or whatever in order to ensure his own survival. He's just counting on this guy's self-interest and survival instinct really to prove that all these rules, I mean, yes, you're right. The doctors in that episode are they're not seeing themselves as responsible. And I suppose that's the thing with these doctors working for insurance companies. They might say, well, that's my job. There are certain rules. It's up to these patients to read the contract carefully and to read the fine print and to make sure that they've, ticked the right boxes and so on. It's not morally my responsibility. But at the same time, as I say, that doctor was, almost in tears, kind of revealing that she kind of recognised the part that she'd played in this. And I suppose that's sort of what the doctor is trying to get these people to see, that they are making choices, that yes, just because someone's laid out that there's a certain rule doesn't mean that the right thing to do is to follow it. And one of the things I suppose that's interesting about the episode is that the doctor does start quite quickly playing the system one way or another, reallocating resources from one floor to the other, treating patients for one condition that they don't have in order to cure a condition that they do. And in some ways it does remind me actually of the kind of weird hoops that doctors jump through, certainly even within our own system, where there are certain rules about what they are and aren't allowed to do. So, for an example, one thing that doctors are not allowed to do is perform euthanasia, but they are allowed to give morphine in quantities that terminally ill patients will die. And often they will ask families, would you, they'll say things. I mean, I've been in this situation myself with a relative where I only realised later what it was the doctor was trying to get at, because they'll say things like, this person is not feeling any pain, they're not experiencing anything, not feeling any discomfort. However, would you like us to give them more morphine? And you sort of think, well, what does that mean? Why would you do that if they're not feeling anything anyway? What they mean is if you say yes, then they will give it because they're allowed to do that. And then the result is that the patient will die. So there are kind of situations like that where doctors are kind of playing their own system because they know what they think is the right thing to do, but there is the kind of apparatus that they have to operate within, and they're trying to find the best way of doing the right thing within it. I mean, in the doctor's case in the Voyager episode, it blows up in his face because he thinks he's come up with this great solution and manages to treat all these people on red level that normally would only get the kind of treatment on blue level, and then discovers that it's been held against them and they're being punished for his working the system in that way, and they're the ones who end up dead as a result.
But then I guess then that's the sort of issue with this episode though, then, isn't it? Because the doctor in Sicko, who was making decisions that was going to lead to, this patient's death, she was making decisions for financial reasons. She was saving the HMO money, and that was going to lead to this patient's death. When in this particular episode, there's no mention of money. It's to do with resources. And there's one particular point in the episode which is really interesting, is one of the more senior doctors on level blue, which is like the first class private healthcare treatment, says, you don't know what it was like before. There were famines before this. So it's a little bit like the situation we have now with the lockdown, right? So there's a lot of people worried about the economy. And I've heard so many things over the years of why we have to sacrifice this for the economy, that for the economy. If there's one thing that a Tory government is good at, it's talking about the economy. And, they will, for the sake of the economy, we're going to plunge disabled people into poverty. For the sake of the economy, we're going to make this many people redundant. For the sake of the economy, we're going to... So it's very hard to hear that, actually people have to die for the economy, right? But there's a lockdown, and the longer the lockdown goes on for, the more people in this country are going to be plunged into poverty. Healthy, working age people who could have, people who've got to pay their mortgages, people who have, who are already living in poverty are going to be plunged even to further poverty. And the sooner you end the lockdown, the quicker these people can get back to work, the quicker the economy can start running again, like a machine. And the implications are that the less people will fall into poverty, or they won't fall as far into poverty. And there's a very real risk that actually the people who end up in real poverty as a result of the economy or crashing, or a recession, or even, as there's some experts saying, a depression, there could be death as a result of that. I mean, not to even to mention mental health conditions. There could be stuff like hunger, there could be suicides, all that kind of thing, right? But if you end the lockdown earlier, you're going to get wave upon wave of coronavirus infections. You're going to get a second wave, possibly a third wave, and then more people are going to die from coronavirus. So, it's like a lose-lose situation. But I feel like with the healthcare system with the HMO is a bit different. Where's the losing there? The losing there is the HMO will lose money because they're going to have to pay out for somebody to have life-saving treatment. It's that the people who are running the HMO are going to lose their profit. And in this particular episode, because it's set in a Star Trek universe where money is not really a thing, it's not about profit. It is about them sort of saying, there's no, part of the problem with the episode is they never sort of show what happens afterwards. You know, do they allocate resources in a smarter way? Was that just the thing? Was that just the problem that they had where they were allocating resources like inefficiently? Or is it that they actually have such a huge population that they can't provide healthcare to everybody? And then the whole planet descends into chaos again like it did before the administrators arrived.
Well, there is in a way a political element to it, certainly in the real world. I mean, I think it's extraordinary, the situation we're in at the moment. We're seeing a Conservative government basically doing things that if a Labour government had ever proposed them would almost have been unthinkable in any other situation. I mean, this is the most, on one level, that we are currently living with the most left-wing Conservative government we've ever experienced, insofar as they have reluctantly. I mean, and this was not Plan A, though. You know, Plan A was this idea of herd immunity. It was this idea that basically we were going to protect the economy and sacrifice a large number of, you know, assumed to be elderly or otherwise vulnerable people, in the way that has been called for. You know, we've had Toby Young, for example, writing think pieces basically saying, you know, people should be willing to risk their lives for the sake of the economy and for the country. In America, you had, I can't remember who it was, someone basically saying, yeah, certain people should be willing to die for the economy. So there is a kind of certain strand of more right-wing thought that believes that protecting the economy is sort of the most important thing. I mean, in fact, though, what we've seen is the Tories coming around, basically realising they tried to float that idea. It didn't wash at all because the country turns out to be slightly more politically switched on and sort of basically well, either left wing or just sort of humanitarian and you know, valuing
people don't want
of
to
life.
die.
Exactly, yeah, exactly. And no, you know, everyone's happy for someone else to die, but probably not themselves or their relatives or whatever. I mean, not everyone is. You know that even those people probably aren't happy for it to be their own grandmother or elderly relative or whoever it is. So they kind of were forced into a bit of a U-turn in a sense, you know, to the extent that you've been sharing petitions online calling for universal basic income. I mean, I don't think that is going to happen by the sounds of it, but they have already gone a long way. I mean, you know, I'm self-employed. They've put in provisions to help self-employed people. They put in provisions to help people whose businesses have been affected. They've ploughed a monumental amount of money into trying to help people financially get through this in ways that, you know, traditionally a Conservative government would not, you know, they would sort of see that as people's own problem to sort themselves out and their own kind of challenges and a sort of slightly sort of survival of the fittest and so on. So that we have seen in a way a weird increase in these kind of socialist, for want of a better word, policies. And it is kind of interesting. They keep talking about the war. Everyone keeps bringing us back to the war and the Blitz spirit and what it was like in the war and so on. And even the Queen, we saw in her broadcast, basically quoting Vera Lynn, very canny bit of kind of PR there, I think, and sort of saying, you know, I lived through the war, you know, because she served obviously in the forces during the war. And kind of saying we need that sense of camaraderie. We need that sense of community again. And it's fascinating, I think, not only that the Tories should be able to kind of summon that. And of course, Boris Johnson has always wanted to be Winston Churchill. And you know, he's written a biography of Winston Churchill. He sort of models himself on Winston Churchill to some extent. And I think that's one of the reasons that he has this kind of larger than life personality in a way, and projects this sort of image of himself, as ridiculous as it may seem. In some ways, he's almost, maybe in this, he's kind of found a way to live that out, to some extent, or to kind of bring us back to that sort of wartime situation. And it was, of course, the war that gave us the NHS, because, you know, it was in the years after the war that suddenly the country did sort of move massively to the left, and you know, people wanted this kind of welfare system. They wanted this sense that, you know, we'd all got through this terrible thing together, by seeing ourselves as sort of, you know, one people, and there had to be some kind of recognition of that and some kind of payback of that once the war was finally over. So, you know, who knows? People have been saying maybe once we come out of this crisis, are we going to build a better world? Are we going to build a better country? Is it going to be a moment to be seized to sort of try to improve a lot of things. I mean, is the NHS finally going to get the funding that it has desperately needed for many years and actually be saved from being driven into the ground? Because for years, people have been saying, the Tories are deliberately defunding things like the NHS in order to justify privatising them, because they can say, look, this thing isn't working. We'll bring in a private company and they'll do it on a different model and that will be more successful. So I would say in the Star Trek episode, yes, there is that kind of argument being made. They have to make some argument, don't they, to justify it, because on the face of it, what they're doing is so obviously immoral. So they have to have some kind of justification for it. I would sort of question, is that necessarily... Okay, maybe they did that for what they thought was a good reason, but that doesn't mean it was the right thing to do. There may have been other alternatives that were ignored or that were not taken on board. And the fact is they have ended up with this deeply unequal and quite cruel system as a result of it.
Well, I guess you have to ask, if there aren't enough resources to go around, why are there not enough resources to go around? It's a bit like asking, when somebody in the news starts saying, well, this is so unprecedented, you have to ask, is it? And why is it so unprecedented? I mean, perhaps maybe we could have prepared for a pandemic, because there was studies done in 2016 to show that the UK was woefully basically unprepared for a pandemic, and that a pandemic was almost top of the risks for this country because we would do another pandemic, worldwide pandemic. And that scientists have been warning about that for years. I mean, you could ask, why aren't the resources there? And I think that's maybe one of the things that they just don't have time to show in a Star Trek episode. But that would be one of the questions maybe Janeway would ask when she arrives at this planet is you say that you have to have this healthcare system like this, which allocates resources based on merit or usefulness of the individual. But because, you don't have enough resources before that and, the whole society was falling apart. Well, why? Like you said, maybe there are other options. And I think that one of the things I notice in Star Trek, and I don't know whether they do this deliberately, but nobody lives in a mansion. Maybe for Picard and his big house, in the vineyard.
Whatever Raffi calls it, his fancy chateau,
Yeah, but you feel like that's kind of inherited. I mean, that's inherited wealth, I guess. That's not exactly very good either.
And it's unusual. It's certainly unusual.
But he's also sharing it with two Romulans. He's sharing it with two Romulans. They live there with him. Do you know what I mean?
Look, they have to work for their board, though, don't they?
Yeah, but almost...
they have to make the breakfast or whatever.
Every other Star Trek... TV series or film. I mean, I'm thinking about Picard's quarters in The Search for Spock. They're not that massive. Do you know what I mean? He's an admiral. He's probably fairly wealthy by this point.
Kirk's quarters
in Search for Spock. Yeah. Nobody seems to be...
He's got a nice view, but I know what you mean. They're not living a kind of palatial...
Yeah. So maybe we've got to ask the question, people are talking about minimum wage, they're talking about universal basic income. They're talking about all these things. Perhaps we need to maybe ask, should there be a maximum wage? Shock horror. Okay, sort of Trek FM listeners, you're thinking Clara's a communist. But what I'm saying is that maybe nobody should ever be allowed to get so wealthy that they have more money than they could ever spend in their lifetime, because that money could be reallocated somewhere else to keep somebody else afloat. I have long argued for universal basic income, and every single time I've been in a social situation, normally a dinner party, where I've talked about universal basic income, I've always come up against the same arguments again and again, which is that it would grind our economy to a halt, because if people didn't have to work in order to pay their rent or pay their mortgage, if people had enough money to survive without having to go to their jobs, why would people work? Nobody once asked the question, what would happen if no one could work? How would anyone stay afloat? And this is a prime example. No one can work, except for key workers, obviously, like we were saying. What would happen when people can't run their businesses? And I think that is when something like this becomes useful. And there are situations in Star Trek where you see people working away. Normally we're in Starfleet, so people have always got a job to do. But there are situations in Star Trek where you see, people, and you're never quite sure what they're actually doing. Do they have jobs? What kind of lives are they living? But apart from sort of I guess we're seeing now in Picard, the Romulan outposts and stuff, people are living perhaps in bad situations, or the Maquis were living in bad situations. But most people in the Star Trek universe seem to have a fairly okay life, enough to eat. They have access to medical care, They have leisure time. They don't, and apart from the fact that there's a lot of war in the Star Trek universe, which is another whole nother subject, it does make you question that maybe that providing people with the basic needs that they have, providing people with the care and also fulfilling their basic needs, and maybe will lead to a society where when something catastrophic does happen, people don't fall through the cracks.
Absolutely. Yeah. I mean, well, who knows? Like I say, I think I'm not holding out too much hope that this crisis is going to transform our country or transform the world, but it may do in some ways. It may leave legacies, and certainly, the war was a pretty awful experience for civilians in Britain who lived through it, but it did lead to various positive changes, most notable of all, probably the National Health Service. So I guess that's a possibility. I mean, who knows? That would be nice to think. That would be the kind of Star Trek ending, wouldn't it? We all come through it together and, we're better for it and we learn something from it. And I think, seriously, though, it is encouraging to see, as you say, the sort of local groups of volunteers helping in various ways. That clapping for the NHS is not just about valuing the NHS. I think it is also, it's very powerful because it is a kind of way of coming together as a society and as a community and feeling like, I've gone out and, stood on the street outside my front door and joined in with that. And you're communing with your, from a safe distance with your neighbours effectively, because everyone's doing the same thing and it's a moment of kind of solidarity in a way. Everyone is saying the same thing. And yes, in this instance, they're specifically applauding those doctors, nurses, those kind of key workers, frontline workers, basically. But they're also kind of saying, we're all on the same page here. We're all doing the same thing. And one of the interesting things here about the social distancing, and I don't know how this compares in other countries where they've had different kinds of lockdowns and so on, is the way that the government has sold it is they have played absolutely on this kind of love for the health service, this kind of passionate belief in the health service, because the phrase they use is stay home, protect the NHS. Now, they're actually not just saying protect the elderly, protect your mothers and fathers and grandmothers and grandfathers and so on, who are, my mother, for example, is completely, locked down because she's in that age group. So she's not supposed to be going out for her daily exercise. I don't think she's not allowed to go to the supermarket in the way that I am and so on. But they're not saying do these things to protect those people. They're actually saying protect the NHS, protect the capacity of the NHS to treat people so that we don't get to this nightmare scenario where basically more people are coming in than can possibly be treated and people are just left to die, are denied treatment, because that is the real horror in a sense, isn't it? Is that people are just going to be refused treatment because there aren't enough beds or enough ventilators for them and they're going to, die waiting to be seen. But also protect those people who are working there, because we have seen huge numbers of doctors and nurses, contracting this disease and dying from it. And I was quite shocked when they first started talking about this, before we had the lockdown and everything, and they had news coming in from Italy, which was quite scary and quite shocking, but we sort of hadn't got to grips with the idea that the same thing was going to happen to us. I saw a doctor on the news who was saying, this is real, this is going to be really tough, and our colleagues are going to be dying. And I sort of couldn't quite believe that she was saying that, because I don't think I can't think of another situation in my lifetime where we've had a scenario where doctors and nurses are literally in danger of their lives to that extent. I suppose with 9/11 we had the firefighters and so on who were developing all these kind of health conditions and so on.
I think in other parts of the world that's been the case, though. Like that's the thing. I just think the narrative that exists in the press and also that our government is giving, and I would say maybe perhaps a lot of governments are giving around the world, is that this is something that is unprecedented. This is something that is unusual, and it's not. It's unusual to us because it hasn't existed or it hasn't happened to us. We don't have personal experience of it, but we're being asked to use our imagination. I think there are lots of people who work in medical institutions around the world. Like, for instance, you can watch a whole number of documentaries about doctors working in Aleppo in Syria, where hospitals were deliberately targeted by Assad's forces. So I think, that's a different situation. That's war. That's not infectious disease. But right away, it was quite clear from the beginning that from what was happening in other countries, the capacity in a healthcare system with the rate of infection were two things that were very serious and could potentially come together at a particular point and create a huge pressure. And I think that that's part of the problem. Part of the problem is everyone's acting like this is something that has never happened before. That's not the case, not the case at all. Even just over 100 years ago, it was happening with the influenza outbreak in 1918. It's just that it hasn't happened to us personally. And that's part of the problem. That's what kind of is what healthcare is all about. If you in a socialized healthcare system, you have to be able to pay for people who are having health problems that you do not have. I don't have experience of cancer. I mean, I do. My mom's had cancer, but I personally haven't had cancer. At the moment, I'm not really at risk for cancer, but I'm willing to put my tax money towards cancer care. You know, I don't want cancer patients in this country to have to rely on medical insurance that they can or cannot pay. So this isn't, it's just that we personally ourselves have never lived through it. And so, and I think that's probably kind of, that's the point of Star Trek as well, is like being able to care about people who have a different experience of your own than your own, and being able to actually understand people's different experiences and different points of view, to look at everybody together collectively and not just your own narrow point of view. So I would say that, yeah, it's unusual and it's weird and it's scary for us, but many people have lived through stuff like this already in the past. And there have been people who've been living in lockdown in other situations around the world in recent history. So I would be very careful by saying that like, we don't have enough knowledge of this kind of thing, because we do.
Well, some people do. The experts do. I suppose the man on the street or the woman on the street doesn't, and that's part of and the politicians don't necessarily, because as we know, they weren't going to the briefings and they weren't paying attention and they were not listening necessarily to those experts. And even as I say, I was watching the news, hearing this doctor saying doctors and nurses are going to be dying in large numbers, and thinking, that must be an exaggeration. That can't possibly be true, because, because exactly in my experience, even when there've been outbreaks of things, sort of a medical outbreak of something, or even, going back to say something like HIV was a massive, in some ways a similar situation, but I don't think you were having, the transmission system there was such that the doctors would not be, I mean, the whole, that whole thing with Princess Diana shaking hands with the HIV patients, the AIDS patients, was basically saying, this is safe. There's not a danger to people coming in contact with them. In this instance, it is very much, it does feel, I mean, people are calling it the plague. It does feel almost like the plague. There's this kind of paranoia and this idea of, staying away from people, and kind of anyone could be a threat to your very life. And obviously that means that the doctors, who in many cases, as we know, are not being properly protected, they're not receiving the equipment they need. I mean, there's been a lot of debate here in the UK about people not getting the masks and gowns and things that they need. In America, there were nurses who died because they were using bin bags because they didn't have appropriate clothing. And I heard someone talking, a reporter, who was saying, though, in the very hospital where those nurses were lacking the equipment, at the time there was a film crew filming them, and all the film crew had the appropriate equipment that they needed, because their TV company or whatever had paid for them to have it, but the hospital or the, whatever the system was, had not paid for the nurses to have it, and therefore they were risking their lives quite, directly. But I guess it also raises this question of, I mean, this Voyager episode, it's called Critical Care. I mean, we've had a lot of talk here in the UK about intensive care and, what does it mean to go into intensive care? We had a Prime Minister taken into intensive care, something that I think, I have no idea when the last time that might have happened would be, but certainly not within our lifetimes, and not, I think, within many people's lifetimes, that something that drastic. We were literally at the point where the Prime Minister could have died, potentially, we were being told. Now, in the episode, there's this interesting discussion about critical care, because the doctor says, they keep talking about level blue. The doctor says, level blue must be your critical care area. And the administrator, I think it is, comes back with, he says something like, level blue is the area where it's most critical that we provide good care. It's not, so the idea of, something is not critical because it's a matter of life or death. It's kind of prioritized according to need, according to danger. It's critical because it's prioritized sort of politically. It's a decision has been made that this thing is more important than that thing. So I suppose it kind of raises all these questions. I also sort of wonder whether there's a bit of a pun in the title of the episode that it's critical care, insofar as that it's kind of critiquing the system of the care that's being provided as well. But I think it is unusual, the situation that we're living in, that people are not only getting ill, not only going into hospital and so on, but they're going into this absolute crisis situation, this life or death situation, this ward where, you know, the likelihood of coming out is not necessarily particularly high. You know, some people have been saying once you go in there, you've kind of got a 50-50 chance of surviving even. And that is understandably extremely scary for people.
I think, yeah, again, it comes down to personal experience. I myself have been not in intensive care, but I've been in an acute care ward, like literally minutes away from being put on a ventilator myself because I have acute asthma. And so as soon as somebody started talking about ventilators, I knew exactly what they were talking about. And one of my work colleagues at the time was like, oh, well, as long as they've got enough ventilators. And I almost felt like saying, well, actually, you don't want to ever be put on a ventilator because your chances of surviving on a ventilator are 50-50. And you do realize they have to sedate you, like completely put you under, to put you on a ventilator. Coming off one's very hard. And she had no idea. And she had no idea because she didn't know what a ventilator was, and she'd never been in a situation where she couldn't breathe properly, whereas I had, so I knew what that meant. But I think this is a really good life lesson for everybody, because it's allowing us to see that what applies to one person doesn't fit everybody. So, for instance, you know, I read about a case where a young man, he was living with his boyfriend. His boyfriend caught the virus. His boyfriend then passed it to him. His boyfriend was sort of sick for like 4 or 5 days, but not, you know, like had a mild fever, felt a bit tired, but managed to be okay. He passed it on to him, and he was ill for like 2.5 weeks, and he had to go to hospital to be put on oxygen, and he could barely stand without any sort of, he had like a fever for like 10 days straight, and he could barely stand. He's too exhausted to stand. And, you know, he's like 35 years old in the prime of his life. And you think, well, it just affects elderly people who already have health conditions, blah, blah, blah. And there may be some truth in that. But there's also this truth, which is that how a disease affects one person it will affect another person completely differently. And that's actually a good lesson for everything in life. You know, just because you have a personal experience of this doesn't mean that somebody's not going to have a completely different experience of that situation. Like, you know, somebody has this reaction to that, and then someone has a completely different reaction to the same thing. It's a good lesson that everybody's different, and that we have to kind of think about everybody when we're thinking about medical care, when we're thinking about financial aid, when we're thinking about, you know, life experience, we're thinking about, you know, life choices, quality of life, everything. So it's a good life lesson to learn, I think, that this isn't something you can just write off as in this is only going to affect all of this one demographic, or it's only going to affect people in this certain way. I think some of the people I know who are young and healthy and have been quite sick have been really shocked that it affected them this way. They thought they were kind of immune, you know, I don't obviously think people should have to get ill to learn this. People should be able to learn this in a much milder way, hopefully. But it is definitely a lesson to learn that, like, our personal experience of one thing isn't necessarily universal or the same type of experience. I think the interesting thing about this episode, like critical, is that it all comes down to who determines what is critical. And there's a moment in the episode where I think the administrator says, Chelik says something like, he's not essential, or he's not important, or he says something like that. And the doctor says, important to whom? Or essential to whom? Because obviously this young man who sadly dies, and I'm glad that the writers decided to kill him because they needed to hammer that point home. I thought he was going to like recover and become a doctor, and I was glad they didn't have a happy ending. Is that he is essential. It's just like, how do you determine critical? How do you determine essential? Do you determine critical or essential because people are, you know, I don't know, like really educated and they are, agricultural engineers, like one of the characters in the show? Or do you determine they're essential because they are really supportive to people in their community? Or do you determine they're really essential because they have 3 kids at home? Is someone who's childless and not got dependents less critical than someone who has got kids? Or are they really critical because, they provide some essential service? Or are they critical because, like, everyone's critical, aren't they, really? Like, you could ask anyone's loved ones and they would say, yeah, this person's critical to me.
This, I suppose, came up with the question of, the Prime Minister being in intensive care. And there were these sort of questions raised, is he getting the same treatment? And I don't really know what the right answer to that is, because, is he getting the same treatment as everyone else in that ward? He talked about, didn't he, how there were these 2 nurses basically standing by his bed 24/7, checking all his readings and so on. Now, I assume that not everyone who goes into intensive care is getting quite that level of, dedicated support. But it is interesting that he was on a ward, he wasn't in a private hospital. He was on a ward with other patients in a similar situation. And I don't know what the kind of, we have seen inequalities in the system, say, around the testing. How did Idris Elba get tested so quickly? How did Prince Charles get tested when these tests are supposedly not available? It does sort of seem like the rich and the famous and the kind of influential figures have access to things that the rest of us seem to be denied. Even frontline medical staff are being denied when they say they need them. But you're right, on one level, if you're looking at it from a medical point of view, the criteria are different. And actually, it's not that everyone is equal necessarily, because, as I've said, there is a mechanism of triage. There are systems in play in which one person gets seen before another, and therefore one person does get prioritized. And even in Star Trek, the Doctor talks about, in that episode, Latent Image, how he would make a medical decision to save one patient rather than another if he can't treat both of them at the same time. But that would be made on medical grounds, not on financial or other, whatever your kind of, this quotient that they keep talking about in the episode, whatever your system is of valuing one person more than another. And that's really the key thing, is from a medical standpoint, it's very important that everyone is basically treated as equal, albeit medically there might be reasons to treat some people differently from others. And I suppose when you get into this question, as you say, does it make a difference if someone has children who are relying on them? Does it make a difference if they're younger or older? And I guess it makes a difference if they're older purely because their likelihood of surviving is different, and therefore that becomes a kind of medical factor. But it is sort of tricky in some ways, isn't it? Because you could say, you might have a 70-year-old in fine fettle and in very good health who, could live for another 20 or 25 years, and you might have someone much younger who was in, a much worse state. So making these kind of decisions is incredibly difficult, very challenging. And really that's the other reason they've been saying, protect the NHS from having to make these unspeakable, we did an episode on Sophie's Choice, these kind of almost Sophie's choices potentially in terms of treatment. It's not just that we want to limit the number of people dying, though obviously that's a huge part of it. It's that we don't want to plunge ourselves into this hellish situation where people, even with good intentions, are making these terrible decisions that are hard to live with. And, you can see the way that it haunts, say, the woman in that documentary Sicko, who's made these awful decisions because of the insurance apparatus that she's become embroiled in because she's taken a job working for this insurance company. You can see in Critical Care, the doctor is sort of trying to open these doctors' eyes, saying to them, look what you're contributing to, look what you're playing a role in, look what you're kind of you're continuing this system, you're kind of propping up this system to some extent. Where are those kind of moral decisions and judgments made, and what are the, how can we create a system that doesn't end up having these kind of immoral aspects to it? I suppose a system that is just, that is fair, that is equal, that is because if it's genuinely a social system, if it is, as in our case, a national health service, it's supposed to be for everyone, then it's very important that it be seen to be fair, that it be seen to treat everyone equally, that it be seen to kind of operate on a fair basis.
Yeah, and these sort of decisions that you're talking about are decisions that are going to have to be made by people on the front line, actual medical staff. And one of the things I thought was amazing about Critical Care was that the decision was made by Chelek. Well, it was made by the computer, actually. They got like this sort of anonymous, unemotional computer to make the decision. And then they got Sherlock to sort of administrate it. And he says something, doesn't he, in the episode, which I thought was really interesting, which was he says something like, I make the decisions that my employers employ me to make because they don't want to have to make them. So it's like, it's almost as if the NHS, like, it's almost as if like emergency room doctors, A&E NHS doctors were like, I don't want to decide between these two patients. I'm going to go to like this computer screen. I'm going to punch in some buttons and I'm going to make this computer choose for me instead. Or they just went to some random person in an office, like some administrator in an office, and they were like, look, we got this difficult decision to make. I don't want to make it. You make it for me. And no doctor in the NHS would do that. Like, you know, that's not how like doctors in our world work.
And yet that is kind of how it works in America, isn't it? Because that's what you see in that documentary Sickos. That is how that insurance system is working. It is, the decisions are sort of being referred up to some bureaucratic level where people are just sitting in offices stamping forms and making these decisions about people's lives, really. They're not being taken on the ground. And I think that's the key thing. And you're right, in the episode, okay, it's a computer that does it. And this sort of goes back all the way to, you know, in the original series, there were all these episodes where there turned out to be some sort of heartless computer running things, and the sort of horror of the society run by a computer one way or another. But it is absolutely, it's almost the system is heartless. I suppose that's it. There's no compassion in there. That, you know, the doctor comes in, despite being a machine himself, you know, despite being a hologram, comes in with this very human compassion, instantly sees people suffering and wants to help them, and then finds that there's this system which sort of, it dictates all these rules for who can be helped and in what way. And as you're right, as you say, that they've sort of taken responsibility for those ethical questions away from themselves by putting it on this computer and saying, well, it's just a calculation, it's just a formula, it's a quotient, it's, you know, something that is the decision is taken on this very abstract level, not on the personal human level.
Yeah, and I think the fact that like they've done that means that they kind of don't want to make these decisions, and if they don't want to make those decisions, it's because they're upsetting difficult decisions. And if like, do you know what I mean? As in like, maybe there is an element of something wrong in the decision that they're making. Otherwise, why would they find it so hard to do? I think what I would really love to see is like a follow-up episode of Critical Care, like Critical Care Part 2, where they go back and they have a conversation with the politicians who run that country or run that planet. Because I think because he talks about the people who hired him to make these decisions. And I'm like, who are these people who hired you? They obviously don't want to make these decisions, and they want to hire this administrator to come in and put this allocated computer and do it.
It's like that George Clooney film where he goes around firing people. Have you seen that one? He's the guy who's brought in to sack people on behalf of these companies that don't want to do it themselves.
Yeah, and then you think, well, if you really don't want to do this, and it's really that bad and that difficult to do, maybe it's because it's something that isn't right, you know, like maybe it's because it's something you shouldn't be doing. I mean, obviously, I'm not talking about the NHS in this respect, because, you know, they're like, they aren't making financial decisions. Well, to a certain extent, I guess a postcode lottery is, but they're not making financial decisions like in terms of HMOs in the US. But like, if you're going to actually, you know, make a decision that's going to destroy somebody's life, and you really feel that it's possibly the wrong thing to do, and you're uncomfortable about it, maybe that's because it is the wrong thing to do. The thing that struck me the most about the documentary Sicko, but also the American system, and I hope I don't offend any Americans when I say this, which is that it seems like giving people the healthcare and the treatment that they need is expensive. And that keeping people alive and allowing them to have operations and paying for the operations is expensive. And that, short of people continuing to pay in to their insurance, their medical insurance, if they survive, whatever, and they continue living on, I just don't know if these insurance companies are ever going to reap back the money that they have spent on people. Like, I do wonder a little bit sometimes, after all the healthcare treatment I've had on the NHS, if I'm going to end up costing the NHS more than I'll be putting into it. Hopefully not. Hopefully by the end of my life, hopefully I'll have years of healthy life ahead of me. And hopefully by the end of my life, I'll put more money into the NHS than I will have taken out of it. But in the capitalist system, you know, it's about making money. Money is king. Profit is important. And keeping people healthy isn't a money-making enterprise. Do you know what I mean? You can't really make money off healthy people. They can go to work and they can generate income for the economy, but like paying for someone to have, it's not like a transaction. Like you pay for someone to have a drug and do you end up with a healthier person, or you pay for someone to have treatment and end up with a healthier person, but you don't end up with a profit off the back of that. It's not like selling ice cream where you might get a profit. Do you know what I mean? And so I think in a way, that is one of the major issues with a profit-based healthcare system. And that in the terms of the HMO, like they're not just concerned about resources. They don't want to even give the resources because they don't want to lose money. Whereas at least in critical care, they have the resources. They just can't. They're just basically bad at allocating them.
I suppose it comes down to whether you see treatment as a right, you know, in the same way as you might see whether you see something like housing as a right or not. I mean, there are certain things that in all countries people agree need to be socialized to some extent. I mean, okay, maybe not. You know, we've seen these protests recently with these people with their guns and protesting about the lockdown and so on in the States. And you know, this kind of idea of these kind of the right to bear arms is tied up with this idea of local militias. But most people believe that you should have a police force to maintain safety of citizens. Okay, well, that is a social, you know, that to me, that's not fundamentally any different to having a health service. They believe that someone should be maintaining the roads that they're driving on. You know, there are things, if you're going to live in a modern society, that have to be taken care of collectively. And for those of us in, you know, Britain and in Europe generally, where healthcare is considered one of those things, it's kind of, I think for most people, it's sort of a given that if you get sick, you should be looked after. That is part of the kind of social, you know, the kind of social contract. That is part of being in a society, of being a part of something, is that on some basic level, we look after each other. But I think it's interesting when you talk about these kind of the computer and the role of the computer, these kind of inhuman decisions that are being taken, whether they're being taken by a literally inhuman computer or, as you say, one of these kind of evil administrators who makes abstract decisions and is never on the ground to see how they play out. I mean, we do see that even in something like the NHS. You know, there has been a kind of creeping privatisation to some extent of the NHS, which has changed some of the ways that it operates. And you do find if you access the NHS and you go in, and doctors will sometimes say things to you, a bit like they say about the morphine, you know, do you want the morphine that doesn't quite make sense? They will sort of nudge you towards saying, you know, do you have the means to go private with this problem? Because basically we'll do whatever we can. This is what we can do. We can do this, this and this. You might have to wait 9 months for this thing. You might have to wait a long time for this thing. And sometimes they'll sort of say, oh, you know, but if you, you know, if you can afford it, there's another route, and I'll give you the phone number of the person to ring, or I'll tell you how to do it. And actually, even in NHS hospitals, there are kind of private appointments happening in the same buildings because they're hiring the offices from the NHS, and the same consultants are doing a mixture of their NHS work and their kind of private work. So there is this kind of weird system where the two things are coming into very much living sort of side by side in a slightly uncomfortable way, to me anyway. But you also see this thing, and this kind of came in really with the new Labour government under Tony Blair and so on, I think, this kind of treatment of the NHS as sort of publishing figures, almost like sort of league tables and so on. So treating the user as a consumer as much as a patient in a sense, and this idea that they need to have information to make decisions. And you can, to a certain extent, like you say, you can choose your GP surgery or whatever. But sometimes these things lead to weird ways. I mean, the doctor, as I say, was sort of gaming the system on that planet, or on that floating hospital above that planet or whatever. But we get weird things. So like my GP surgery, I mean, actually, notably, since I've moved out of London, you see a doctor much more quickly. It's a lot easier to access healthcare. All of this stuff is much, much easier. Whereas where I was living in South London, it was, you know, it was tricky. But where I was living in London, to see a doctor, you had to ring at 8 o'clock on the dot in the morning, and then you would get through. There would already be, basically, if you rang at 1 minute to 8, you wouldn't get through. If you rang at 8:15, it was kind of pointless. All the appointments had gone. So there's this mad scrum in the morning to get the appointments that are doled out, and you're on hold with 20 other people all waiting at the same time. It's this insane system, and I'm sure that is to do with some kind of they want to be able to say everyone is being responded to within a certain period of time, or everyone is being seen within 48 hours or whatever it is. So you call at 8 o'clock, and if they've run out of appointments for that day and the next day, they'll tell you to call again another day. They won't make the appointment for later in the week or whatever, because they don't want to say that people are waiting days for an appointment. Well, the fact is, all that means is you're sort of massaging your figures in a sense. You're creating a mad situation in order to make things look better than they genuinely are. You're not actually creating capacity or speeding up how fast you're seeing people, really. You're just kind of making them jump through ridiculous hoops and telling them, oh, sorry, you weren't fast enough in the queue, and therefore you're not going to get seen this time, try again tomorrow. And then we can say everyone gets seen within 2 days or whatever it is, where you actually might have waited 3 days. So there is that danger, I think. And it does remind me a little bit of the idea of handing it over to a computer. It's a bit like in the episode Justice in Next Gen. Picard has this line, there can be no justice as long as laws are absolute. You need a human touch in a way to make those kind of decisions. If you hand it all over to these kind of mechanisms and these systems and so on, and there's no flexibility and there's no humanity in there, the danger is that it becomes just a sort of almost, it becomes kind of arbitrary at one level, and then also that it becomes this weird game of people trying to work around the system and trying to play the system and trying to game the system and work out sort of how to make it work for them. But it's lost that essential human touch and that kind of human interaction, which is so much a part of healthcare in particular, that relationship between the doctor and the patient, and the doctor's kind of desire to help that patient. And that, I suppose, is what we see with the Doctor from Voyager. He is in some ways a more old-fashioned kind of doctor on one level. He's not used to dealing with bureaucracy and institutions and paperwork and all this kind of thing. He's just used to, he gets activated because someone comes in and they're sick, and he does whatever he can to treat them, and then he, blips off or goes off to the holodeck or whatever he does. In some ways you could say the sort of Star Trek model is almost a more old-fashioned model. It's a doctor who isn't compromised by all these kind of problems of bureaucracy, problems of, do I take some private work on the side? How do I balance these different elements in my life? Are there kind of moral quandaries that I'm being faced with where there's, external influences coming into play or whatever? He's able to exist in a very sort of pure and untarnished environment somehow.
He's like a country town doctor.
Exactly, yeah. And with McCoy, of course, is the ultimate kind of old country. You talk about a family doctor. McCoy is the kind of ultimate family doctor, I think.
I think the irony about this whole thing is that, the doctor is a machine. I know we love him, just like we love Data, with their characters, they're people, they have sentience. But the doctor's a hologram, and he is generated by a machine. And I was like, this is a more empathic, nicer machine than the allocator, who, obviously is this sort of unimaginative kind of just basically a computer. But, yeah, and I thought it was kind of a nice twist in this episode that the most empathic doctor, with the exception of the doctor on Red Level, who was trying to do his best with the situation that he's in. He's a product of his system, isn't he? But the most empathic doctor in this whole episode was actually an artificial intelligence doctor. So, he is a machine. He's just a moral and empathic machine. And who's evolved, I suppose, beyond his programming. But yeah, he definitely goes in there and shakes things up. And I would like to know what happens afterwards. I felt like that was the one weakness, one of the weaknesses of the episode. It's a very good episode. It reminded me a lot of the original series, where they go into a world which is basically an allegory for something that's happening in the real world. And they go in, and it's this real injustice happening, and they basically go in and they mess things up and they change things around, and then they're like, bye, and they fly off into space. And you're like, what happened after that?
And Voyager, of course, is the one Star Trek series that literally can't do that, because they can't go back to these planets, because they're on this, forward journey. In practice, Star Trek doesn't ever go back to these planets. Although I know with the Lower Deck series, we're getting a ship that is a second contact ship. So basically, they are the ones who sort of go in and clean up after, they kind of clean up the diplomatic mess that's been made at first contact by whoever, whatever sort of higher ranking personnel were involved in that, and do the kind of more sort of dog's body work. So in a way, it would be interesting, to find out how did these things change. And we don't know, I don't think, all those planets where Kirk went and smashed whatever machine was running things and told them they'd all be happier without it. Who knows what happened next, and how that worked out for them all. But there is certainly a sense, there's never any mention of the Prime Directive in this episode, but it is on one level a kind of Prime Directive situation in some ways, in that there is this system that is existing in this society, and the Doctor is basically just coming in and saying, your system is crap, you need to change the system, I'm not working within this system, you shouldn't be working within the system. And that other Doctor that you mentioned, Yeah, he is kind of basically a humanitarian and a decent guy, but he is fairly compromised. He's a bit slow to kind of wake up to it all. And he does wake up to it all, and he does kind of do the right thing and so on. But it's not like he just needs to be shown the way and then he's totally signed up and committed or whatever. I think quite realistically, it's a bit of a harder sell than that the Doctor has to do on it. But I think you're right. It does feel in some ways a bit like a TOS episode. It is absolutely like Star Trek doing kind of ripped from the headlines social commentary. It is a kind of very traditional Star Trek episode. And Voyager did do, some of these episodes, I think often quite effectively. I mean, another episode from around the same time is the episode Repentance, which kind of looks at capital punishment and the prison system and so on. And again, I mean, some people I think would criticise Voyager. They say Voyager sort of lacks teeth. And I think in some ways there is something a bit murky about this episode. There is this sort of the fact that people can read it as criticising different things, that people can almost take opposite readings out of it, I think is a weakness of it. And I do think in some ways the refusal to talk about money is part of the problem, because really the inequalities that we have in the healthcare system, certainly in the American healthcare system, but even in healthcare systems, even somewhere like this, where, as I say, okay, the NHS will treat you, but they also might nudge you towards private treatment if they think you can afford it. Money is the key thing that is causing all these problems. And obviously, maybe Star Trek in the 90s is not going to come out with a kind of Marxist take on that necessarily, as much as the Federation does appear to be this sort of socialist utopia, effectively. They're always almost slightly embarrassed about kind of putting their finger on that, most of the time.
They never kind of explain how, do they? It's like,
no, they never explain how it works.
Picard is like, there's no poverty, there's no hunger. And I'm like, yeah, but how though? Like, but that's fair.
Well, replicators. I think we just have to assume replicators. You can replicate everything. There's no need for money because goods are kind of, but of course there are bigger, that's a whole economics question to be worked out. And also whether it's really true that the whole of the Federation has moved beyond all of this, or is it just that people in Starfleet get quite well looked after? They get, as you say, decent but not palatial quarters. In some way they get paid, or at least they have access to resources that they need in order to trade with other people. But, it may well be that not everyone is experiencing the same level of equality, in a sense, as what we typically see on screen. But certainly life in the Federation seems to be better than life on this planet in the Delta Quadrant. And I guess, in some ways, yes, it's easy to have the alien planet and say, yeah, well, we're better than that. Our system is better than that. But I think in this case, it's a message that sort of needs to be heard. Certainly it needs to be heard by the people on that planet. And maybe it does need to be heard from those viewers watching it originally. And the episode, of course, I mean, we should probably have mentioned this before, but the episode is written by James Caan, who is someone with a medical background himself. And he also wrote the Voyager episode Lineage, which again has a kind of medical storyline with B'Elanna and her unborn child and the kind of ethics around that. And also we talked about in terms of sort of perinatal mental health and kind of whether there's an element of that going into that story. They talk about sort of pregnancy hormones affecting B'Elanna's behaviour and so on. So he seems like a writer who sort of brought his interest in medicine into Star Trek in a way. And I think this is obviously the key episode for that he's, basically put into a Star Trek episode a critique of, well, certainly from our point of view, the American healthcare system, arguably flaws in any healthcare system, I suppose some people would say. And I think I think it absolutely is about the American system, this episode, fundamentally. And the publicity around it at the time, all the interviews that, say, Robert Picardo was doing and so on, were absolutely saying it was about the American insurance system and so on at the time, and the HMOs and so on. But at the same time, there are elements in there that we can pick out that are really about the experience of delivering healthcare in the modern world, where you're not just a, local country doctor with your, handful of patients. You are working within institutions one way or another, and institutions inevitably compromise individual agency to some extent. And there may be good reasons for that. There may be positives associated with that, but there are problems and issues that get thrown up along the way as well.
Yeah. And I guess as well, again, it comes to this idea of people's worth as well, doesn't it? And that is something you find again and again in Star Trek as a theme in so many episodes. I'm thinking DS9 episode Past Tense, people's worth. What do people deserve in society? How is their worth determined? Do people have an intrinsic worth? Do some people deserve more than others? And that's the theme that I think that you see again and again in today's world in lots of different countries. And people really wrestle with it. and they have in the past, they probably will in the future. But yeah, it's one of those things that they talk about a lot in Star Trek, and it's definitely reflected in this episode. Very explicitly in terms of this computer allocating people based on their worth.
And it's something that we're particularly aware of at the moment as we face this situation where any one of us could find ourselves, in, as you say, not just the elderly, any one of us could find ourselves in dire medical need at any moment. And, at least in this country, we are confident that the best efforts will be made on our behalf, regardless of our financial situation or of our jobs or, any situations like that, if things get really bad, then, maybe not everyone will be getting the treatment that they desperately need, but at least the best effort is sort of being made on our behalfs by those who are charged with keeping us safe and healthy and well. Well, it's been, I don't know if I should say it's been fun. It's not exactly been a distraction from the misery of our everyday lives talking about this, but it's been interesting and I think kind of an important topic to touch on now. This was one we had on the back burner for a while, but we thought if ever we were going to discuss it, now would probably be the appropriate time. And I hope listeners, you found it interesting as well. And it would be great to hear on the Babel Conference anyone who picks up other things in that episode that relate to their own experiences of the health service, whatever, or the health system, whatever country they're in, and how they kind of interpret that. Do you just think we're a pair of kind of loony lefty British people coming at this wildly impractical perspective? Who knows? But I think it's a decent episode of Star Trek. I would highly recommend that Michael Moore documentary. I know Michael Moore's not to everyone's taste, but I think it's a very interesting documentary. I certainly found it shocking about the American system. I wonder from an American perspective, it might be interesting to see, because he does visit Britain, he goes to an NHS hospital, all of that stuff. It feels a little bit kind of cheesy and a little bit overplayed maybe, but at the same time, I think there are some valid points to be made there. But before we wrap up, Clara, any final thoughts on critical care that you want to share with the listeners?
Well, I just feel like I should probably mention how impressed I was with Robert Picardo's acting in this episode. I feel that, he's always been a very good actor. He acts very well in every episode. But in this particular episode, I was actually very moved by his acting. I felt that he can express a lot in very few words, primarily by using his face, his facial expressions. So in some of the scenes when he's just so outraged at the care that these patients are getting and at the inequality in this healthcare system, he's, you can just read everything that he's thinking with the subtle changes of his expression. I was just really impressed.
Certainly the episode wouldn't be there without that performance at the centre of it. And it's interesting. We think of the Doctor sometimes primarily as a comic character. This is not a particularly comic episode for him. The comedy in the episode comes from Janeway, really, on her sort of wild goose chase, trying to track down what's happened to the Doctor's programme. She's the one who kind of gets to play it for laughs a bit. Yeah, Robert Picardo absolutely is doing the sort of... it's interesting you bring up past tense. There is a kind of element of similarity there, I suppose. He's the fish out of water in the kind of backward barbaric society that rather closely resembles our own for purposes of social commentary and kind of, getting a point across to the audience. But it's been good talking about this episode with you today, Clara. This is not the only thing, of course, that we've been talking about on Trek FM this week. So have a listen to what else you might have missed out on the network.
Previously on Trek.fm, The Orb.
But of all the Section 31 that we're getting in New Trek, this feels the most legitimate. This feels like the Section 31 that we know from Deep Space Nine, and it doesn't feel like, we're just going back to the well again, because, even Ira said, I know they've used it in the movies, but we created this.
Earl Grey.
Still no clue. I'm going to kick myself when I get it.
Yeah, tell us, Jim.
Kirsten Dunst.
Kirsten Dunst.
Oh my gosh, of course.
I hate the universe.
Kirsten. My gosh, I knew that. What's wrong with us?
The best Loxana performance in all 7 seasons, in my opinion.
Literary Treks.
If this were an episode of Voyager, and I actually think this book would make an interesting episode of Voyager, and like we kind of hinted at, maybe it's very much like an episode of Voyager that we'll talk about. I don't think it would have been called 7 of 9, right?
No, it would have to have like a one-word title to fit in with most of the other Voyager episodes, so you can't really remember which one it's about.
Yeah, it would just be called
Exactly.
7. That's what it would be.
To the journey!
She did actually mean what she said back in the space just before they die. I don't know, I just kind of like it. It's just
I'm going to
fuzzy.
tell you I love you just before I die. Not a minute sooner.
It's like, at least I don't have to deal with the ramifications if I'm dead. Well, that backfired.
Or maybe she was just like, at least I don't have to hear him not say it if we're going to die.
So what you're saying is next time that we ask someone to marry them, or anyone who asks someone to marry them, they should do it on death's door of like some kind of crazy adventure. Like jumping off a bungee jump.
If you're in the middle of being eaten by a shark or something.
I love you! Gobble, gobble, gobble.
And that's what else is happening on Trek.fm.
Check out all these shows and join the conversation about your favourite corner of the Star Trek universe and beyond. You'll find us wherever you get your podcasts. If you're an Apple user, be sure to hit the subscribe button in Apple Podcasts on iPhone, iPad, or Apple TV, or the desktop iTunes app to get the latest episodes as soon as they're published. And please leave us a star rating and a written review. If you're not an Apple user, we've got you covered as well. You can find our shows on Google Play Music, Stitcher, TuneIn, Spreaker, SoundCloud, Windows Phone, in most third-party apps, and you can stream and download the MP3 file from our website or grab the RSS link. We'd love to hear your thoughts on today's show, and there are many ways for you to do that. The best place to join in the larger conversation is the Babel Conference, our listeners group on Facebook. Just type Babel, B-A-B-E-L, into the search field on Facebook and it should come right up. If you'd like to send us an email, you can use the form on our website at trek.fm/contact. Choose to send to a show and select Primitive Culture, and that will come right to us. You can also find the network on Twitter at TrekFM and on Facebook at facebook.com/TrekFM. If you'd like to help us keep all our shows coming to you each week, you can become a patron of the network on Patreon. Visit patreon.com/TrekFM. That's patreon.com/TrekFM to get all the details. Perks include early access to episodes, exclusive content, producer credits, and more, available through our special patrons website, Patron Zone. It requires a great deal of money to produce, host, and distribute these shows each month, so we really appreciate any support you can give us, and we hope you'll join the team. Again, you can find all our details at patreon.com/TrekFM. We'd like to take a moment now to thank our associate producers on Primitive Culture, Amy Nelson, Clara Cook, and Tony Black. Amy is a presenter of many other shows on the network, and you can find her on Twitter at Miss Amy Nelson. Clara and Tony were two of the former co-hosts of this show, and they'll be popping back from time to time. You can find Clara on Twitter at ClaraJeanMC, and Tony at AJ Black Writer.
You're blended, all right.